Hey everybody, welcome to another episode of One Bypass, One Stroke, One Survivor with my dad, Bill Daly. And today we're going to talk about the different treatment facilities available to you and your loved ones if someone is experiencing or exhibiting signs of a stroke. There's a couple different hospitals. My dad's going to talk about them. And he's going to also talk about the governing body that accredits these hospitals with these special distinctions that allows them to identify themselves as stroke specializations or centers for stroke care. Probably a better way of putting it. So let's not waste any time. Let's talk about it. So I'm going to ask you some direct questions, Dad, and we'll just kind of go that way. So in the moments following someone, you've spent some time on this in other videos, and check out the channel to see videos on what to do in the seconds following when someone is exhibiting a stroke, symptoms of a stroke. But we talked about how we talked about the acronym Be Fast, Fast, and Be Faster. I think it's gone through many different kind of iterations, but we talked about how precious those seconds are when someone's having a stroke. So why don't we talk a little bit about how these hospitals are involved early in the paramedics' decision and what happens to you when they come to your home and they're caring for you in the moments following your stroke symptoms.
Well, number one, of course, the first responders, whether they be the police or EMTs, will try to establish through a series of questions whether or not your problem may be a stroke.
Right.
We've already discussed that.
Yeah. So let's assume that the paramedics believe a stroke
Right,
is you're in the
right.
process of a stroke.
Now most, I shouldn't say most, I believe everywhere paramedics now are supposed to take that patient who's exhibited that particular situation to the closest stroke center.
Okay.
Okay, it may be a primary stroke center, it may be a comprehensive
And
stroke
we'll get
center.
into those in a
we'll
moment. But
exactly.
their job, just so I understand, and so our viewers understand, is their job, paramedics, are to get you to the nearest stroke center.
Nearest stroke center.
So they kind of divorce themselves from whether or not it's a primary stroke center or a comprehensive stroke center. They're just getting you to one that's nearest to them.
Exactly.
Okay. So there's two kinds of stroke centers. There's what are they called again?
Primary care and primary stroke center and a comprehensive stroke center.
Right. And so let's talk about the two of them and just what distinguishes one from the other.
Right. Now, maybe at some point in time, if you're having a stroke, if the first responders have realized that stroke is the definite cause for illness, they will take you. They're required, I believe it is. They're pretty sure they're required to take you to the closest stroke center that's available.
Right.
Okay. When you're having a stroke, you're panicking. You're beside yourself. Where am I supposed to go? Where should I go? Where would you like to go? If they give you a suggestion, where would you like to go? Well, take me to. You want to go to the closest one that you're supposed to do.
Right.
And that's what they do.
Right.
Okay. They will analyze when you get there via imaging what the problem is, whether the stroke is a ischemic,
Or
meaning
hemorrhagic.
blood clot, or hemorrhagic. At that point in time, if it's a ischemic stroke, which 87% of strokes are ischemic, they will administer the drug TPA, which is a clot buster. Okay, that is supposed to break up the clot as best it can and allow the clean flow of blood through those particular arteries again.
Sure.
If it can't break it up, now I've been told that some primary stroke centers have now been allowed to administer this particular therapy, but if they can't break it up, more than likely then they've got to be transferred to a comprehensive stroke center. A comprehensive stroke center.
So primary, hold on, I got to stop you. So primary stroke centers are going to provide TPA.
Right.
But there's comprehensive stroke centers, which you're about to describe. I'll give you the floor in a second. That's sort of an elevated experience.
Yes.
Okay, so go on.
Yes. They have the imaging, the newest imaging, in order to exactly where the clot has been, what is still blocking the area. They've got 24 hours, 24/7 on hand. The stroke nurses, neurosurgeons for surgery, whatever else they may possibly need to administer this, what they call thrombectomy, which even after you've been administered the TPA, this thrombectomy with the X-ray equipment and the imaging that they have now for this particular situation will pinpoint exactly what is still blocking the area, and through medicine or through a surgery, which is thrombectomy is a surgery area.
Right.
They will remove that area by inserting a catheter into the groin, and at the same time behind the catheter will be a
Stent.
stent that will encompass what's left of that clot, ensnare it,
Right.
and the surgeons will pull it back through that particular.
Then remove it from the
They'll
body.
remove it from the body.
Oh, cool.
Had this hadn't happened before. I'm not sure how many years ago the thrombectomy has been in favor, but it removes that clot that they weren't able to kill, extinguish at the
At a primary,
primary.
right, through
Yeah,
TPA.
right.
So comprehensive is going to offer a more aggressive, hence the word comprehensive.
And equipment that they also offer at the same time.
And again, we talked for a moment. We agreed that we were also going to, in this video, address the governing body that accredits these hospitals with these distinctions, with these titles, with
Right.
these the term primary stroke center or comprehensive. So talk about that governing body.
Okay. It's called the Joint Commission. It's actually, their name has evolved 3 or 4 times since then, but they were formed in 1951, and they're a program, a nonprofit program that offers advice and follow-up procedures at, I think there may be at least 4,500 hospitals in the United States, and 82% of them have accreditation from this Joint Commission. They'll send a team. When I say a team, 2 or 3 people into a hospital. They'll look at their procedures, their quality of care, their patient safety, the cost that they have, the cost of the patient.
Right.
One thing it does, for starting with primary care, it enables them, even though there are other avenues of revenue, but it enables them to make available to them the federal funding through Medicare and Medicaid, which is very important, to the lifeline of these
Sure.
particular hospitals. They oversee that. They'll follow costs for patient quality, how much this means for the hospital, how much it will mean for their stature in the community. This hospital now is a primary stroke center. There are places that I've spoken at. They don't have one that really in a city, in a town, a state as big as New Jersey, as far as comprehensive hospitals are concerned. There are, in my area alone, where I live, close to the George Washington Bridge, there are 6 hospitals that are primary and comprehensive within 15 minutes of each other.
Wow.
Okay, that's amazing. I think I had last checked on Google, and I apologize when I say I think, but unfortunately my memory is just not as good as it used to be, that there were only 150, I think, comprehensive stroke centers in the country. Here we are. You think of Chicago or all of the big cities, how important it is. The rural areas,
Sure.
Wyoming, Oregon, you may have to go 150 miles. I would imagine a helicopter would have to take you.
Oh yeah.
In
Oh
order,
yeah. No
in
doubt
order
about
for
it.
you to circumvent the area that you're going to need to, if you need more attention, if you need more help.
Oh yeah.
The accreditation that they give you is the gold standard. It's just what you want, how you brag, the resources that you can obtain, the staff, doctors, surgeons that you can bring on to your staff,
Right.
because of the fact that you have been named a comprehensive stroke center, and not diluting at all the care that you would get in a primary stroke center. But that's where I went when I had my stroke. I had a massive left side bleed. I came through it, as they tell me, miraculously. But that was at a primary stroke center that I went to, and I stayed there for 8 days until they moved me for 78 days into an acute rehabilitation hospital. So no way am I minimizing what they have,
Sure.
but the equipment and the resources that is available to them is not going to be available to the public unless you're at a comprehensive stroke center.
Okay. Anything else you want to add?
No, there's probably 1,000 things that I want to add, but I can't bring them to mind right now.
That's fine. We only wanted to talk about these hospitals and who gives them that credibility. So
Right.
it's fine. Don't forget to subscribe to my dad's channel. Like this video if you do, and make some comments if you have any questions. We'll be glad to field them. And be sure to click that notification button too when you subscribe, so you get push alerts when my dad makes a new video. Thanks, everybody. Take care.
Thank you. Have a great day.